When an ostomy appliance fails and begins to leak, the consequences for the patient are immediate. Exposure to digestive fluids causes rapid skin breakdown, physical pain, and a profound sense of anxiety and lost dignity. To prevent this, we are going to walk through an evidence-based method for a pouch change that ensures a secure, leak-proof seal every single time. The procedure actually starts before you ever touch the patient. Leaving the bedside mid-procedure to retrieve missing supplies breaks your workflow, compromises sterile technique, and heightens the patient's anxiety. Gather all non-negotiable supplies in advance: a clean pouching system, appropriately sized skin barrier, stoma measuring guide, warm water, and soft clean gauze. You also need designated curved ostomy scissors for precision cutting, and an odor-proof disposal bag placed within easy reach of your workspace. Setting up this complete tray beforehand establishes the baseline for safe care. It allows you to focus entirely on the physical technique once the procedure begins. Step 1 is transitioning to the patient. Perform thorough hand hygiene with soap and water for at least 20 seconds, and don clean gloves following your standard institutional protocols. To remove the old appliance, use the pull-pull method. This technique is specifically designed to prevent mechanical stripping of the epidermis. Apply gentle, downward pressure on the surrounding skin with one hand. With your other hand, carefully peel the pouching system away, rolling it downward from the top to the bottom. Never pull the appliance off quickly like a traditional adhesive bandage. A rapid pulling motion damages the top layer of skin and creates microscopic tears. Clean the stoma and the surrounding peristomal skin using only warm water and your soft gauze. Wipe in gentle, circular motions, moving outward from the stoma. Do not use harsh soaps, lotions, or alcohol on this area. These products leave behind chemical residues that will actively prevent your new adhesive barrier from bonding securely. Methodical removal and cleaning with pure, warm water preserves the integrity of the peristomal skin, preparing the ideal canvas for your new seal. Once the area is gently patted completely dry, a brief window opens to assess the clinical health of the stoma. A healthy stoma exhibits specific visual markers. It will be a vibrant pink to beefy red, indicating adequate vascular perfusion and oxygenation to the tissue. The texture should be consistently moist and glistening, similar to healthy oral mucosa, and it should protrude slightly above the skin level. During this window, you must look for critical warning signs. Any tissue discoloration that appears pale, dusky, purple, or black requires your immediate attention. Dark discoloration indicates severe stoma ischemia, meaning the blood supply is dangerously compromised. This constitutes a surgical emergency requiring immediate physician notification. Conducting this rapid, focused visual check during every single pouch change acts as your frontline defense against severe postoperative complications and tissue necrosis. Now we move to measurement. Use your stoma guide to measure the exact size of the stoma at its true base, directly where the tissue meets the abdominal skin. Do not measure the stoma at its widest protruding point. If the base is narrower than the top, measuring the widest section will result in a barrier opening that is entirely too large. Once you have the exact base measurement, transfer that dimension to the back of the new protective skin barrier. This diagram illustrates the physiological danger of inaccurate cutting. If the gap is too wide, highly acidic digestive effluent will pool and erode the exposed skin. If the barrier is cut too tight, it will strangulate the stoma. To avoid both, you must apply the 1/8 inch rule. Cut the opening exactly 1/8 of an inch, or 3 millimeters, larger than the stoma base. Use your curved scissors to cut smoothly along your traced guide. Jagged or uneven edges can rub against the stoma, causing microabrasions and bleeding over time. Precision customization creates a physical firewall between corrosive digestive output and highly vulnerable abdominal tissue. Before applying the new appliance, verify that the peristomal skin is completely bone dry. Even slight surface moisture will ruin the adhesive bond. Center the newly cut barrier directly over the stoma, ensuring the tissue is clearly visible through the hole before making contact with the skin. Apply the barrier by pressing firmly from the stoma outward. This outward sweeping motion smooths out wrinkles and eradicates trapped air pockets. Modern ostomy appliances utilize hydrocolloid adhesives. Hydrocolloids are moisture-retentive dressing materials that require ambient body heat to fully activate and adhere completely to the skin. To lock in the seal, place your warm hand over the entire barrier and apply steady, flat pressure for 30 to 60 seconds. Thermodynamic activation paired with clinical patience transforms a loose adhesive patch into a leak-proof second skin. A successful application has distinct visual markers. You will see a flush adhesive bond, 0 wrinkles, and no visible gaps around the stomatase. With the physical procedure complete, shift your focus to patient education. The most critical long-term maintenance rule is the optimal timing for pouch emptying. This diagram shows the mechanical stress caused by an overfilled pouch. The heavy liquid weight at the bottom creates a pulling vector, placing intense downward strain on the top adhesive bond until the seal ultimately breaks. Instruct the patient to empty the pouch when it is exactly 1/3 to 1/2 full. This specific timing preserves the adhesive seal and prevents overnight leaks. To conclude, safely discard the used materials in your odor-proof bag and thoroughly document the output amount, consistency, and your clinical assessment of the stoma. A secure, meticulously applied pouch change prevents leaks and skin erosion, ensuring the patient maintains their comfort, independence, and dignity.